We're announcing a healthcare plan, a great plan. People are saying it's the greatest ever, the great healthcare plan.
Hey guys, Curt Graham back again from Elite Insurance Partners for another industry update. Today I'm talking about the great healthcare plan that was released by the Trump administration. That's not what I'm calling it. That's what they're calling it. The great healthcare plan's got a knack for marketing. And so it goes into it. And some of the things that you initially see from articles are they talk about direct payments to consumers for healthcare, what policy experts say about the plan. One of the things that they highlight right at the beginning here is the framework scant on details, including eligibilities and payment amounts. So this article focuses on the direct payments and how they're going to do that. It's not very clear, but if you scroll down here, I did highlight one little thing. So with the ACA, consumers can opt to receive those premium tax credits in one of two ways: a lump sum during tax season or via immediate reduction in monthly insurance premiums. The latter scenario is by far the most popular. Right, so people getting the premiums reduced, not waiting for it back and their tax credits. And so essentially the plan that is being proposed is maybe making that more of the standard way so that people are focused on how much it's costing them and actually a little bit more price sensitive, I think might be the way it works, and then getting the tax credit back at the end of the year. But there's other things like being able to use HSA accounts and a few other, options, FSA accounts mentioned in here as well, which aren't really that popular with the ACA. If we come over here, this is an article about how healthcare plans might be impacted. At its core, the proposal seeks to redirect government healthcare spending away from insurers and intermediaries and towards individuals. So again, they're talking specifically about that, and hopefully as well as getting the locking in of the most favored nations drug pricing agreements that has been talked about, talking about transparency, basically making it to where your cost of getting services done are just transparent. Whereas now you go to the doctor and you try to find out what your doctor's visit is going to cost. You've got no idea. It changes depending on who you are, what your insurance type is, who's paying your insurance. Is it through Medicare, Medicaid? Is it an ACA plan or an employer plan? That affects not just your copayment, but actually the overall cost of the doctor's visit in a lot of cases. And so talking about transparency there, I think that's probably a good thing. Let's just jump right in. Here's from whitehouse.gov. President Trump put out a video. You can find it on YouTube and watch it yourself. I don't think it gave you all that much information. I think it basically gave you these highlights here. So lowering drug cost, again, focusing on the most favored nations deal. Essentially, if a drug company is selling drugs overseas for a lot cheaper than they are in America, then why don't we get those lower prices as well? If you're willing to give them a reduction in price, what about us? I think that sounds pretty fair, just in my opinion. Over-the-counter medications, this one's I was a little curious about, didn't really fully get. I do understand, there are a lot of medications that you shouldn't really need to get from a pharmacy that you have to. You got to go to the doctor's office, and so that'll probably save us there. Like they said, reducing those doctor's visits and not having to pay also make doctor's offices less busy, which would be nice. But there is kind of a funky thing that is included in that. Send money directly to the American people. Again, it doesn't give us too many details on that, but we do have some ideas. Fund cost sharing reduction program. This is a little bit more interesting. This is about how the ACA is structured and something called silver loading that I'm going to show you a little bit about. Cut kickbacks to pharmacy benefit managers, or PBMs. If you know anything about the drug industry, I feel like everybody complains about PBMs except for the PBM owners. I know what's his name, Mark Cuban. He's got that cost plus drugs, and he complains and rails about PBMs all the time and how they're driving up the cost of drugs in a lot of cases. So definitely, kind of a bipartisan, popular thing to look at there. Hold big insurance companies accountable, make them use plain English, also publish their overhead and claims payments. They kind of already do that. We know what the loss ratios are because it's actually written into law that loss ratios have to be a certain amount. Otherwise, the insurance companies have to give refunds and lower their premiums. Denial of claim rates. I think this is probably going to be popular with most people, saying that it's going to give us, better information on what insurance companies to go with. So not bad. And also, putting prices on the wall. So essentially, if they accept Medicare and Medicaid, this is kind of what I was talking about in terms of, the transparency. And then they have to prominently post those prices so you know what the cost of the visit should be. If we go over here, this is the Committee for a Responsible Federal Budget, and they go into a little bit more of these in details, again, talking about the most favored nation, basically giving us lower prices. If they're charging cheaper outside the United States, then we should be getting those lower charge prices as well. Making more drugs over the counter. So this is the one that I said is kind of a mixed bag. So it's going to reduce premiums and federal subsidies. So it's going to save, people on the premiums, but it's also going to reduce the government money because these drugs are now going to be fully out of pocket. So if you go to the Walgreens and get something that's not from the pharmacy, you got to pay full price for it. That would be the case. But they are saying this is going to also reduce doctors' visits for getting those prescriptions. So it'll save some money there as well. Like I said, a little bit of a mixed bag. I think in general, a lot of the prescriptions that you get from the drugstore that aren't prescriptions are the exact same as a lot of times that you're getting from the pharmacy. Sometimes they're cheaper for you if you're doing cash pay to just get it from over the counter. So in some cases, I think that's going to be a good thing. Cost sharing reductions for ACA plans. So ending silver loading. So this is what I was talking about that I wasn't really fully aware of. And if we come in here, essentially the way the subsidies for the ACA works is there's two major types of subsidies: premium subsidies and the cost sharing reduction subsidies. So the cost sharing reduction subsidies are your out-of-pocket costs, copays, deductibles for the lower income beneficiaries. What were the insurance companies? They all kind of figured something out. Insurers adopted a practice called silver loading, in which they incorporate the cost of paying CSRs into premiums of silver tier plans, because ACA subsidies are calculated based on silver plans. Increasing the premiums in these plans also increase the subsidies paid by the government. So they figured out, hey, if everything is set off silver plans, let's make the silver plans more expensive and we're going to get more subsidy dollars. And so that's silver loading. Basically, the way it would work is you drive up the cost, of a silver plan. As a result, the subsidy would have covered most of the cost for a bronze plan and is large enough. Now it's large enough to cover the full cost. The same subsidy that covered a third of a gold plan would instead cover almost half the cost. And so here's their illustration of without silver loading and with silver loading that was going on. So essentially driving up the overall subsidy amount. And people, I'm sure, are happy about that because they can get a bronze plan for essentially nothing. And then, have less cost on a silver and on a gold plan, but it was costing the federal government a boatload of cash. And so wanting to end that and make it to where people actually have to pay normal cost sharing amounts. I discussed the PBMs, basically, getting kickbacks to the PBMs from the big pharmaceutical companies. And essentially all those guys is a middleman. The pharmacy's not buying it directly from the drug companies. So there's no real drug transparency, cost transparency, because it's all going to one centralized group that sells it out to everybody. And they can essentially kind of set the prices as a cartel in a way. So I think that's going to be very popular. I've heard a bunch of people on both sides of the aisle complain about PBMs. They're definitely not the most popular group right now. Price transparency. Again, if they accept Medicare or Medicaid, they have to, make it clear in plain English. There's some mixed reviews on what that would do. Is it actually going to drive down cost? Some people say, yes, it'll drive down cost a lot. Other people say it might only drive down cost by, 1 or 2%. I don't know. I think transparency is probably a good thing. I'd like to know what the cost of something is before I actually get that service. And that's not the way it is at the doctor or at a walk-in. A lot of times you give them your insurance card and they don't tell you until after you're done. And then you're like, well, I would have maybe not got that x-ray or something. I would have thought twice about getting some of those extra services done, because I know that that's a crazy amount of money that you're charging for that. So I think overall, transparency is probably a good thing. They also did come out with a quite a funny government website, trumprx.gov. I doubt this is going to last beyond the Trump administration, being that his name is on the website. This is supposed to make it more clear on what the overall drug costs are, and hope that it lowers prices because of transparency. One of the critics here, there's plenty of critics, but I always refer to the Kaiser Family Foundation. They put out a lot of great stuff. In here, they do point out a few things that they're critical of. So it's not entirely clear from the summary exactly what it's meant by send money directly to the American people. Congressional Republicans have offered, different ways of, for instance, expanding health savings accounts. And they're not sure what that means. One of the options was giving people the ability to buy non-compliant ACA plans with some of the subsidy dollars. So essentially, if as expected, healthier people choose to go medically underwritten, then it would leave basically the sickest people in the marketplace and cause a death spiral. That's one of the things that a lot of people don't realize is, when everybody has to buy it from the same place, essentially the healthier people are subsidizing the sicker people. And so what they're saying is if people can, pass medical underwriting because they're not as sick, because they're healthier, then they're going to choose to go and buy a cheaper plan, or a plan that maybe doesn't cover certain things that are forced to be covered in the ACA plans. And they're worried that that's going to end up, causing the cost of ACA plans to rise. Makes good economic sense why that would be the case, but it also makes economic sense for those healthier people or people that don't want extra things in their healthcare coverage to not have to pay for those things. So I'm not sure, how I feel about that criticism. Again, the president's plan is vague, and without knowing more, it's impossible to say the implications on how it would affect those with pre-existing conditions who rely on the ACA market. So again, they're going back to, if somebody, is able to buy a plan because they can pass medical underwriting, all of those people that can't pass medical underwriting are end up going to be in, sicker, and it's going to drive the cost of those plans up, which is, it makes good logical economic sense to me that would be true. But again, it's one of those things where, hey, if I can buy a cheaper plan, or if I can buy cheaper car insurance because I'm not as much of a risky driver, I'm not a 16-year-old kid that just got his license who's driving, crazy all the time, then I should be able to get some cheaper health insurance. So I think it's really your philosophy towards health insurance and how it works. I know on the Medicare side, especially with Medicare supplement plans, when people are medically underwritten, it does cause them to choose different plans based on price and based on underwriting standards. And so it could possibly work out better for some people, and some people end up having to pay more. So again, mixed bag, a lot of interesting stuff. Essentially, what it comes down to is this is just a framework. It's not going into law unless Congress acts on it and actually does something, but it does move forward the conversation we've been having about the Affordable Care Act, or Obamacare, for the past 10 years now, to maybe something that's a little bit better. I feel like everybody's was saying that the Affordable Care Act was going to solve it, and now we're saying we need to fix the Affordable Care Act. I know in the insurance business, as an insurance agent, we've had all sorts of different changes to the way the insurance companies pay for those ACA plans over the years. And so, hey, we have to see what comes out, a little bit more details down the road. I wanted to give you my opinion on that. Hope that was useful. If you've got any questions, don't hesitate to either drop a comment below or click on the email address and send me an email. Would love to have a chat with you and answer any questions that you guys might have. Y'all have a great day. I'll talk to you again soon. Thanks.